Did you know, in the United States, traumatic brain injury is the greatest cause of mortality and disability among children and young people? An estimated 1.5 million Americans suffers a traumatic brain injury each year. 230,000 people are hospitalized and survive as a result of their injuries. Hello, my name is Ana Mihilo and I will be your teacher for today's video. Let's get started. So what is traumatic brain injury? Traumatic brain injury or TBI is a type of brain injury that occurs suddenly. It can happen when the head is hit, bumped, or jolted. This is an injury to the closed head. When an object penetrates the skull, it can cause a TBI. This is a puncture wound. A TBI symptoms can range from minor to severe. Mild TBI includes concussions. Concussions can have catastrophic consequences, although the majority of people recover entirely. Serious physical and psychological symptoms, unconsciousness, and even death can result from a more severe TBI. Depending on the severity of the injury, doctors usually divide traumatic brain injury into 4 categories. They'll utilize the Glasgow Coma Scale or GCS, which is a scoring system based on a person's degree of awareness after a TBI to determine the severity. The GCS consists of 15 points. Each point measures various functions such as an eye opening and verbal response. The higher the points a person scores, the higher their level of function, which indicates a less severe injury. The longer the recuperation time, the more serious the brain injury. Recovery is always a possibility even in the most severe cases. Doctors employ additional criteria to identify brain injuries in addition to these categories. There are different sorts of traumatic brain injuries, and the doctors usually divide them into 2 categories: closed injuries and open or piercing injuries. TBIs that do not fracture the skull are known as closed injuries. When the skull bone cracks or is punctured, the brain is exposed to the elements. So first, there are concussions, which are one of the most common types of traumatic brain injury. While concussion were once dismissed as minor annoyances, doctors now treat them as such. Concussion symptoms can range from minor to severe, and they can sometimes last a lifetime. Fortunately, there are therapies for post-concussion syndrome that can help you manage your symptoms. So, concussions are frequently accompanied with contusions. The severity of a contusion is determined by its size, location, and duration. A contusion that does not heal on its own might develop into a hematoma, which doctors can remove with surgery. Several types of localized traumatic brain injuries exist, including hemorrhages. Focal brain injuries are injuries that impact only a small portion of the brain. While these injuries usually produce less severe damage than other types of TBI, they can nonetheless be fatal if not treated swiftly. Hematomas might take days or weeks to appear following a head injury in some situations. Vomiting, severe headaches, and even pupil diameters and impaired speech are all symptoms of hematomas. If you have any of these symptoms following a brain injury, contact your doctor right once. The epidural and subdural hematomas are the 2 types of hematomas. Blood collection between the skull and the brain is known as epidural hematomas. Blood collection beneath the thin layer of protection that surrounds the brain or subdural hematomas. Blood collection within the brain or intercerebral hematoma. A Coop-Contrecoup injury is a serious type of traumatic brain injury that occurs on the opposite side of the brain from where the blow struck. Most Coop-Contrecoup injuries happen when a person's head collides with a stationary object such as a steering wheel. The brain goes forward until it collides with the front of the skull. When the skull collides with the item, the force then rebounds off the front of the skull and strikes the rear, resulting in a second impact. Axonal shearing is a term used by doctors to describe one of the most serious types of traumatic brain injury. Because most diffuse axonal injuries involve only microscopic tears, they are difficult to detect on an MRI. The name implies these injuries occur when an object, most commonly a bullet, penetrates the skull and the brain. Never remove an object stuck in someone's skull until they have been checked by a doctor, since doing so could aggravate the bleeding and cause further damage. There are educational challenges for students who have or have had traumatic brain injury, and the impacts of TBI vary considerably from one student to the next. Because traumatic brain injury disrupts the regular functioning of the brain, it may induce educational changes. When nerve cells in the brain are destroyed, they lose their ability to communicate with one another normally. This causes the person's behavior and talents to alter, depending on which areas of the brain were affected the most. The injury could produce a variety of issues. Educators and family members must be aware of the injury's type and severity. A neuropsychologist and other rehabilitation professionals can assess the student's present strengths and abilities and make recommendations for in-classroom and out-of-classroom support. This information can be utilized to identify which classes the student should be in and whether any classroom adjustments are required. Physical therapy interventions for traumatic brain damage have as their major goal for the recovery of independent movement. Activating a phenomenon known as neuroplasticity is one of the most efficient methods to do this. Practice movements that have been compromised by traumatic brain injury on a regular basis helps to reinforce demand for those functions and promote neuroplasticity. This explains why a physical therapist will ask you to repeat an activity numerous times, because the more you practice, the more neuroplasticity is activated. Neuroplasticity in the brain helps to strengthen those new neural connections. Neuromuscular education can help you improve the function of your nervous system and the way it moves by doing so. By consistently stimulating the brain through passive exercise, the individuals may be able to gradually develop movement in their affected muscles. FitMe, for example, is an at-home physical therapy gadget that can help you achieve just that. FitMe takes you through the greatest PT exercises in a fun and engaging style. The viscosity of water provides greater resistance to movement, which aids in the development of muscle strength and endurance. That's all I have for today, and I hope you learned something from our lesson on traumatic brain injury definitions, types, educational challenges, and intervention.